Okay, now we're working on amiodarone. Amiodarone or cortisone. This is a class 3 antiarrhythmic. Okay, class 3 antiarrhythmic. What does an antiarrhythmic do? It stops arrhythmias. Or dysrhythmias, if you want to be correct. Its action, it prolongs action potential and duration in cardiac tissues through sodium, potassium, and calcium channels. It blocks both A and B adrenergic receptors. Weird looking lowercase a and weird looking B receptors. Okay, so let's do that again. The action of amiodarone is it prolongs the action potential and duration in cardiac tissues through sodium, potassium, and calcium channels. It blocks both alpha and beta adrenergic receptors. So it's both an alpha and a beta blocker. It prolongs the action potential and duration in cardiac tissues. What does that mean? It is raising the threshold of excitability. It is making it take longer for that electrical impulse to make it through the cardiac tissues. Okay? So what are our indications? Ventricular tachycardia. Okay. Ventricular fibrillation. And narrow complex tachycardias. Okay. We use it for VTAC, VFib, and narrow complex tachycardias. What is our dosing? 150 to 300 milligrams. IV, IO. Remember, here, at least in Finney County, if we're running a code, if they're at VFib, they're going to get an IO. Anything you can give through the IV, you can give through the IO. Okay? So with that, our contraindications. Breastfeeding. bradycardia. High-grade heart block. And, of course, our favorite, hypersensitivity to the drug or allergy. Okay, let's go back and talk about dosing for just a second. So in our dosing is 150 to 300 milligrams. That's not quite right. That would be on your first dose. So if you have pulses, if you're in a tachycardia with pulses, you're going to give 150 milligrams with pulse, 150 milligrams over 10 minutes. Okay? 150 milligrams over 10 minutes. That is a tachycardia with pulses. If you are in VFib or pulseless VTach, you are going to start with a 300 milligram bolus right away, and then if needed you will do an extra 150 if needed, or if they regain pulses. Also, high-grade heart block, third-degree heart block. Think third-degree heart block with that. If you have a third-degree heart block, then amiodarone is contraindicated. So, we'll just third-degree heart block. Now, some of our adverse effects will be hypotension, bradycardia, and prolonged PR interval, QRS, as well as QT. Why would that be? Why would we see those as adverse effects? Because we are prolonging the action potential and the duration through the cardiac tissues. So this is not unexpected. If you are giving amiodarone to somebody, you should already have these, but you're going to do constant EKG or ECG monitoring. And amiodarone is now first line in VFib and tachycardias. Is now your first line med.